Good morning. Thank you for joining us for this webinar this morning. I'd like to introduce our speakers. Dr. Rachel Hardeman is a reproductive health equity researcher, and her program of research applies the tools of population health science and health services research to elucidate a critical and complex determinant of health inequity, and that's racism. She leverages the frameworks of critical race theory and reproductive justice to inform her equity-centered work aimed to build the empirical evidence of racism's impact on health, particularly for Black birthing people and their babies. And we'll be hearing about this today in the webinar. She's received numerous awards for her work, including being named this year the first Blue Cross Endowed Professor of Health and Racial Equity. Her research has been very well funded by the NIH, Robert Wood Johnson Foundation, and many other sources. She's a principal investigator on MoreLab, which explores and defines ways to measure structural racism for the purposes of empirical quantitative investigation. She's published her work in Thoughts in top journals, such as New England Journal of Medicine and the American Journal of Public Health. And this has recently elicited important conversations on the topics of culturally centered care, police brutality, and structural racism as a fundamental cause of health inequities. She is a member of the Minnesota Maternal Mortality Review Committee, the CDC Maternal Mortality Review Information Application Bias Work Group. She serves on the board of directors for Planned Parenthood of the North Central States. She'll also be joined today by her doctoral student, whom she'll introduce, JAMAR. Thank you so much for taking the time to speak to us today, Dr. Hardeman.
Thanks so much for having me. We're really excited to be here. I'm going to take a minute to introduce JMAG, and then I'll get my slides up and going and we'll get started. So I'm excited to be here today with JMAG Karbeah, who is a fourth-year doctoral candidate in the Division of Health Policy and Management, and also an alum of the Maternal Child Health Program here in your division in Epi. And I had the distinct honor of meeting and connecting with JMAG in 2016 when she was actually just finishing her first year in the MPH program. And we've been working together ever since. And you know, her work has really sort of pulled in her training from maternal child health, along with health services research and demography. So she's also, I didn't mention, she's also a pre-doctoral trainee in the Minnesota Population Center Population Health Studies program. And so JMAG's work really has pulled in all three of these disciplines to explore the impact of structural racism on maternal and child health inequities. And her scholarship has done that in a bunch of different ways, from examining the alternative perinatal care models like the Roots Birth Center model of care through projects that that we've had funded through the Robert Wood Johnson Foundation. Her work has really thought about how do we acknowledge and challenge how anti-Black racism is perpetuated in public health and medical institutions. She and I recently published a paper that really sort of shines a light on how we need to be thinking about dismantling structural racism and white supremacy within the field of health services research. And then she's also doing some really, really important and timely work for her dissertation that's examining police contact as a form of structural racism that impacts adolescent health outcomes. So stay tuned for that work as she moves that forward. And today we are going to talk about a research project that we embarked on, gosh, 4 years ago, I think. And it's been an interesting ride. And you know, is even more timely now, sort of given what we face as a society, or what we have continued to face as a society. So I'm going to get my slides up and running, and then we'll jump in. I'm going to take the first half, and then JMAG will jump in and about halfway through. All right, can someone just give me a thumbs up that all is well? Thanks, JMAG. Okay, so our presentation today is titled Momma, an exploration of the intersection of police brutality and Black motherhood. And briefly, I'm going to offer some background and kind of set the stage for us. And then we'll talk a little bit, JMAC will jump in and talk a little bit about our research project and share some of the findings. And then we want to spend a little bit of time also talking about the process, because there's some interesting things that have happened along the way in the process of both writing and proposing this research and also carrying it out. And so we'll talk a little bit about that and then have some time for question and answer. So I think by now we have certainly all read the stories of Mr. George Floyd's death in May of 2020 in South Minneapolis, just 2 miles from where JMAG lives and just 6 blocks from my childhood home from where I grew up. And you know, as many of you know, Mr. Floyd was detained on suspicion of forgery and died at the hands of a Minneapolis police officer who kneeled on his neck for 8 minutes and 46 seconds. And Mr. Floyd's extrajudicial killing is not unique, sadly. This is a photo of Eric Gardner, just one of the many Black people in our communities across the country that have been killed by a police officer. And Eric Gardner died under similar circumstances just 6 years ago in New York City when he was placed in an illegal chokehold by police officers who suspected him of selling loose cigarettes. And it's an unenviable task to be a mother of a Black child in America. And every single death of a Black person at the hands of a police officer is tied to a mother. That every single person is a child. And the Mothers Movement is a group of parents that have come together, some of the most high profile Black victims of police violence in America. They've come together under the shared pain and the shared lived experience of raising and losing children in a system, in a system of police violence and structural racism. And so this is a photo of some of those mothers: the mother of Sandra Bland, Trayvon Martin, Eric Garner, and Sean Bell. And this isn't a new phenomenon. This isn't a new thing. So this photo is a photo of Emmett Till's mother. Emmett Till was murdered in 1955, and his mother insisted on having an open casket for her son's funeral services because she wanted to shine a light on just how horrifyingly damaged her child's body was, and really raise shine a light on the suffering and the pain and the grievances that needed to be brought to bear for Black mothers who have the horrible have experienced these horrible tragedies. So many of you may have seen photos such as this one in the aftermath and the civil unrest after George Floyd's murder in our community. And I just want to take a minute to center us and recognize that this is a difficult topic. It's a painful topic. It is one that certainly presents trauma for many of us. And I just want to read some words that I wrote about it after George Floyd's murder, and then take a minute to pause and sort of hold ourselves and center ourselves in this space for just a second. "Mama," George Floyd called out, face pressed against the pavement with the knee of a Minneapolis police officer in his neck. "Mama, I'm through," Mr. Floyd yelled. George Floyd's cry for his mama resonates deeply with all of us. We all know what it feels like to need our mom in times of fear and distress. Yet there's something else haunting and painful in Mr. Floyd's words, a cry for help so profound it summoned all Black mothers in America, shaking us to our core, evoking images of our beloved Black sons and Black daughters stolen from us too soon. Stolen life and stolen breath, whether from police violence or entrenched inequities and maternal mortality, leave far too many Black people calling out for their mama. And I would just ask that we just take a couple of seconds to take a breath, to think about Mr. Floyd, his family, his mother, and the mothers of the many, many people who we've lost over the years. Thank you. And as I'm sure many of you know, Mr. Floyd's story is not the first high-profile police killing to happen within the Twin Cities, and I fear it won't be the last. We have a lot of work to do to make that, to shift that reality. We as Minnesotans like to consider ourselves unique and the best. We refer to ourselves as a place where all the women are strong and all the men are good looking and all the children are above average, right? But when we talk about police killings of unarmed Black men, we see that we're not exceptional. And our record is actually pretty disgraceful and dismal. This is from the Star Tribune, where they collected the names and the stories of everyone who's died after a physical confrontation with law enforcement in Minnesota since January of 2000. And what they found is that there's been 199 deaths over that time period. They also show that nearly 30% of those deaths were Black people. However, Black people only make up 7% of the population in Minnesota. A few names and faces to those dots on that graph or on that paragraph that or figure that you just saw. On November 15th, 2015, Minneapolis police responded to a call on the city's north side that resulted in the fatal shooting of JAMAR Clark. In July 2016, not far from the University of Minnesota campus in Falcon Heights, Philando Castile was shot and killed by a Falcon Heights police officer. On June 23rd of 2018, Thurman Blevins in North Minneapolis begged, "Please don't shoot me," as two Minneapolis police officers closed in during a foot chase. And we show those three and name those three people in particular because as we embarked on this research project, those were the names that had been in the press or were in the press during the process of this project. And, that's not to say that there aren't many others that should be named as well. So what we know and what we suspect is that, police brutality and the effects of that violence permeate the very conditions of existence in communities that are already marginalized and already vulnerable for many reasons. We see that over surveillance in marginalized and vulnerable communities, coupled with that looming fear of death at the hands of police or being over surveilled or having disproportionate police contact, is harmful, potentially harmful to health and well-being. And we were really interested in exploring this topic from the lens of reproductive health, and particularly from a reproductive justice lens that I'll share in just a second. So our overarching question for this work that we started in 2017 was what feelings persist in the aftermath of continual loss of life of Black men at the hands of police for Black mothers and Black people of reproductive age. So as Mark said in my introduction, I use a reproductive justice framework to frame a lot of the research projects and the research questions I seek to answer. And for those of you who are unfamiliar, reproductive justice is a movement that was started by women of color activists led by Loretta Ross and an organization called Sister Song. And this group was actually a group of Indigenous women, women of color, and trans people who had always fought for reproductive justice in some way, shape, or form, but the term reproductive justice wasn't actually sort of put out there and invented until 1994, when a group of Black women gathered in Chicago that year to have a discussion about how Black women in particular were left out of the sort of women's rights movement that was often led and continues to be led by middle class, well-off or wealthy white women. And so they decided to form sort of their own movement to uplift the needs of Black women, Black birthing people, marginalized women, families, and communities. And that's how reproductive justice was born. And there's three sort of central pillars or principles of reproductive justice. The first being that everyone has the right to decide if and when they will have a baby and the conditions under which they will give birth. The second is to decide if they will not have a baby and the options for preventing or ending a pregnancy. And the third, and the one that I think is the most important for us to focus on in this work, is that women have the right to parent the children they already have within with the necessary social supports and safe environments and in healthy communities without fear of violence from individuals or from the government. And right now, that is not a reality for any Black birthing person who is living in a community that is experiencing the trauma of police violence. And so that's really the framework that we have used to approach this, this particular study. And so just to sort of clarify the intersections of reproductive justice and police violence, the comprehensive sort of perspective of reproductive justice embodies this recognition that it's not only important to fight for the right to have a child or not have a child, but really that it's equally important to advocate for safety and to parent in a safe community where there is not concern of state-sanctioned violence or any other forms of violence along the way. And that's really, again, the premise for which the research questions and the study that JMAG is going to tell you about has really come from. So with that, I'm going to stop my screen share and turn it over to JMAG to talk a little bit about the work that we did.
Thanks, Rachel. You just fumble with this a little bit. Am I up? Yeah. All right. So as Rachel stated, this work is inspired by this deep history that that she has just shared, and also the persistent threat of police or state-sanctioned violence against Black folks. And so this work centers on North Minneapolis. Well, initially our proposal was to focus on North Minneapolis. As we will talk about later, and she kind of alluded to, it's where we see the highest concentration of Black folks within the Twin Cities area and within the state. And this is an area that has been historically disenfranchised and economically underdeveloped through intentional, sometimes inexplicit efforts at disinvesting from Black communities. And this came to a head in the mid-1960s when you had large civil unrest in North Minneapolis as the community called for more supports and more investment. And that's a history that we live with today, especially when we look at the infrastructure that still exists in North Minneapolis, specifically the health infrastructure there that was a direct result of this community voice need for more support. So the demographics of North Minneapolis, as we said, is nearly 60% African American on the north side, compared to about 20% in the city overall and about 6% in the state. Just for folks who may not be familiar with the Twin Cities demographic layout. Additionally, when we talk about North Minneapolis, we are talking about a population that is considerably younger than other communities within the Twin Cities metro area. And with that, as public health professionals, we know comes with unique needs, specifically also in terms of life course transitions around educational supports and employment opportunities. So again, North Minneapolis is historically and contemporarily underinvested. We see some of the lowest median household incomes within this community, with median income being under $30,000 compared to other points in the city, such as South Minneapolis and the Columbus neighborhood, where we have median household incomes much closer to 100,000. So we have huge economic disparities when we look at our North Minneapolis community or our predominantly Black communities versus when we look at our predominantly white communities in South Minneapolis. We also see, as maternal and child health scholars, there are also glaring racial disparities in birth outcomes within North Minneapolis, specifically the Camden neighborhood, where we see rates of infant mortality at 8.2 infant deaths per 1,000 live births compared to 3.6 in Southwest Minneapolis. So not only are these communities economically underinvested, we see a public health crisis when we look at perinatal outcomes in these communities. So taking that all together, I'm kind of speaking for Dr. Hardeman here, but being in a landscape where you see this community, a community from which you are from which you are a member of, that is facing very real perinatal health disparities and economic disparities, and you know that racism is the direct cause of these disparities, and you also know that a huge part of that is talking about the tangible forms in which structural racism operates, so the institutions that perpetuate this structural inequity. And so at the time, one of the first, there's very little scholarship around structural racism and policing within public health. And it wasn't until 2016, 2017 that you had this large or growing body of research, specifically starting with Dr. Hardeman, Medina and Cosmonel's New England Journal of Medicine piece directly after the murder of Philando Castile, that kind of drew attention to police brutality and police violence as a public health issue that required not only public health professionals, but health professionals to act upon. And you also see other scholarship by scholars out of the University of Minnesota, alumna Syria Lang, along with Dr. Hardeman. They also wrote about why we have to pay attention to police brutality as a public health issue. And so this 2016 is when you start seeing the scholarship that says policing is a public health issue, but the real connection to this maternal and child health outcome is comes out of our Dr. Hardeman's work at Ruth's Birth Center and talking with Black birthing people and hearing very real and deep fears about having an ultrasound and finding out the sex of their baby because they were afraid to have a male child, that they were afraid about what it meant to bring a child into the world who would be suspect and a potential victim to police violence, police brutality, and police surveillance. So that goes back to our reproductive justice conversation, right? These are birthing people who are in a moment when they should be joyous and happy and celebrating the bringing a new life into the world, are instead afraid because they know that bringing a Black male child into this world could mean losing that child at the hands of law enforcement. And so not feeling like they had a safe community or that the government or law enforcement would keep their children safe, but would instead harm their children. So again, going back to this current study and our research question of what are these feelings and what are these realities? Because in the literature, there is very little within the public health literature that deals specifically with this topic. There has been some great qualitative work and smaller studies, and also great theoretical pieces. There's a 2017, I believe, AJPH article that talks about theoretically, how do we start thinking about the consequences of police violence from a reproductive health perspective. And that inspired this current study. And so our study set out to be a mixed method study, so both a quantitative survey as well as a qualitative survey. And I will talk more about both of these sections later, but when we set out to conduct a survey with 100 respondents, and we were very fortunate to have stellar response rate with over 250 folks responding to our survey. And these are folks within the Twin Cities metro area. As I stated earlier, we started out with North Minneapolis, but as we had conversations with ourselves and as we started recruiting, we realized that the Twin Cities are a unit, they are a community, and to not include Black folks living within the entire metro area, we were missing part of the story. And so we expanded our study population to the entire metro area. And our qualitative component, we hope to do 4 focus groups with 30 folks and subsequent key informant interviews with 20 folks. But as is the nature with qualitative research, we did not have that much success. And across both our key informant and our focus group interviews, we had about 20 respondents. And we can talk at the end about the issues we encountered and even how our positionality, we can talk about the history of the university and how that hinders this type of research and why that's an important thing to be cognizant of as researchers. And a lot of our recruitment efforts would not have been possible without our community partnerships with Broadway Family Medicine and North Point Health and Wellness, especially the staff at Broadway Family Medicine. So Dr. Shaili Prasad, Dr. Andrea Westby, and several residents at Broadway Family Medicine went to great lengths to help us connect with patients who were in their clinic and may be interested in our study, as well as providing us with the physical space to do some recruitment. And that was really an invaluable part of our recruitment strategy. As far as our survey development, we've talked about the unique positionality. We've talked about reproductive justice, but we were fortunate enough to consult with a scholar, Dr. Fleda Mass-Jackson, who has done a lot of the survey development work around the unique intersections that Black women experience. And so she has developed a contextualized stress measure that has been validated that looks at the unique forms of stress that Black women face. So not just this racialized stress of being Black, but also this gender stress of being female, and gets at this intersectional identity of being a Black female, Black woman, and what it means to exist within that context, within what we know to be an extremely anti-Black society that also is very patriarchal. And additionally, we drew on the work of the Justice Study, which was a study out of San Francisco led by the Do No Harm Coalition. So this is a group of physicians who in 2017, in response to several police killings of unarmed Black people, provided medical support to a group of community members who underwent a hunger strike to protest the rampant and very devastating impacts of police violence within the San Francisco community. And so these folks, this Justice Study dealt with law enforcement violence in various forms, and we drew from that their specific policing questions, whereas they dealt more broadly with things like immigration and customs, border patrol, and also dealt with more sensitive forms of violence, such as sexual violence at the hands of law enforcement. So we're very fortunate to draw on these two studies for our survey development, as well as the addition of additional survey questions that dealt with kind of this very gendered exposure to police contact, which leads into my dissertation research. So the results of the study, our study population was, again, these are all Black women within our study population. We had a relatively young sample with the vast majority of respondents being under 35. We had an extremely highly educated sample with most folks having high school or college education. The majority of our sample was not married, and we had median household income, the majority of our population being between $30,000 to $50,000 or above household income. So now thinking about the survey, I will share just 4 questions that we asked on the survey and the responses there. So we asked survey respondents this broader question about, to what extent would you say that you're afraid of police officers? And we had 73% of our samples say that they were afraid to some extent. So this is folks who are moderately to folks who say that they're extremely afraid of police officers. And to give a more specific context, we asked about fears about police violence within their community. And we allowed folks to define their community to be as granular as their block or their immediate community like Camden or Jordan, something like that, to a larger Minneapolis community. And with this, we saw nearly 80% of respondents saying that within their specific community that they lived in, they were particularly concerned about police violence impacting them. To get at this reproductive justice angle, we asked respondents the degree to which they felt that living in a community that had experienced these high-profile cases of police violence had impacted their reproductive decision-making. So we have 56% of respondents saying that this exposure and this community level police violence had impacted their decision to have or not have a child. And additionally, we see 73% of respondents saying that living with police violence has directly impacted the way that they parent. When we look at our qualitative results, so when we actually sat down with folks over the course of, gosh, it must have been 2 years. So we started our first qualitative interview in 2018 and we wrapped up this summer. And we see three main themes emerge. We see this idea of vigilance, not only for in their roles as parents, but also as Black people living within this community, that you are constantly afraid of interacting with the police. Or we see a lot of conversations about how I feel like I have to carry myself just in case I encounter the police. I have to be nice. I have to make sure that I don't do anything wrong. I might even avoid calling law enforcement when necessary because I don't want to become a victim when I'm trying to seek protective services. Additionally, we see this theme of protective parenting. So a lot of our survey participants talked about the things that they do for their kids. And I think it's a conversation worth having about what it means, not only for parents, but their children to be under such high surveillance. So parents thinking that they need to be there all the time with their kids and kind of controlling their kids' environments, and what that means developmentally for children, that their parents, in order to protect them, are kind of taking away their ability to kind of roam free or have their own experiences due to this threat of being killed by law enforcement. And third, a thing that we heard a lot about was this idea of reform, and that reform was necessary. And the fact that it's a multifaceted theme, right? So both police officers need to do things differently, but also this idea of our community needs additional resources that are not law enforcement. So this idea of defunding and reinvesting was very apparent in the interviews that we conducted. So on this theme of vigilance, for the sake of time, and in order for us to have a conversation, we'll read one of these. The top one, a respondent said, it makes people to the point where they don't want to go outside or they don't want to drive their car because they don't want to get pulled over. And what happens if they get pulled over by a crooked cop and get shot? So this direct awareness of, if I contact law enforcement, I could die. And we know from studies that this is not a fear that white people have in our society. A white person being pulled over is afraid of getting a ticket. A Black person is afraid of never seeing their family again. When we talk about protective policing and what parents, how parents negotiate this, we see a lot of parents struggling with how do I teach my kids about this very real threat, and when do I teach my children about this threat? And so our top quote is from a parent who struggles with, do I tell my 6 or 7-year-old about the policing? And we also had folks with very young children talking about, how do I tell my child who's excited about seeing a law enforcement officer that they might not be safe around this officer? And secondly, we have a parent of an older child who talks about, I have to prepare you for what life is like in the world when you encounter a police officer, because I don't want you to get killed. So the stress that there must be for a parent to have to think about losing a child and having to be a part of the socialization that they do, rather than just watching their child grow up and develop into a happy and healthy adult. On reform, this top quote exemplifies a lot of what we heard. This idea of, I don't feel like the police are here to protect me anymore. I feel like they are just here to harm Black people and take our lives away. And the second quote on the bottom talks about this community policing disconnect. The fact that I am an adult person, and even as an adult, I don't feel respected or seen as an equal to police officers. And I feel that I'm being infantilized. And I feel that I am being kind of watched over, and I don't feel like that's the job of law enforcement. So this idea that law enforcement should reconsider what their role in a relationship is with the community. And so those are the themes that we've seen arise in our qualitative work, as well as our quantitative results. And I alluded to kind of the next steps, and as we think about the implications of this work that was intended to be a pilot study, and I think has a lot of promise for additional applications in other communities to give us further insight. We are wrapping up data analysis on both the quant and the qualitative piece. I'm very fortunate to be working with Remy Abulu, a second-year medical student who I believe is on the call and has been instrumental to this data analysis. Also, as a demographer, thinking about what this work means from a life force perspective, I talked a little bit about this protective parenting piece, and as a demographer, but also as a public health researcher, what does it mean for child development if Black children are being hyper surveilled by their parents and by law enforcement, right? If they are not allowed to develop on their own and have their own independent experiences out of fear of death, like what does that mean for how they transition through the life course and how they develop into adulthood? And second is this idea of legal estrangement, which comes from the criminology literature. And what we see in the qualitative work is this tension between folks wanting law enforcement to protect them and folks wanting to feel like they can call law enforcement when there is an issue, but also this very real fear that they will not be listened to, or that they may not be safe doing this. So some of the language that we see, both in the legal estrangement scholarship and also in our study, is this idea of, yeah, I wish I could call the cops when I needed them, but they won't come when I need them. And so we have folks talking about how even with this hyper surveillance when needed, they feel that law enforcement response is inadequate or delayed. And so how do we kind of reconcile this dual reality within this community? And to our larger points, how do we think about what this means for birthing people? What does it mean to deal with the stress during pregnancy? Both as a person who may already have a child and is currently pregnant, so watching over one child, but also what it means, going back to that quote that we heard in the Root study, what does it mean to find out that you're having a male child and be so afraid of losing that child? Although we know that the risks are not uniquely gendered, that Black female and male children are equally vulnerable to this. And also looking more at how reproductive decision-making is influenced by this unique exposure that Black folks face. So how do people choose to delay childbearing or not have children at all in response to what they see as very real threats to their safety? And in the time we have left, just hitting on barriers and limitations, and I invite Rachel to add on to this. So the study was an experience, I think, every step of the way, specifically talking about the Institutional Review Board, and even I think Rachel can attest to just applying for funding for this. The idea, which may have shifted in the last 6 months, that when the study was proposed, a lot of people didn't believe that police brutality was a public health issue. They didn't see it as a pervasive issue. When applying to the IRB and attempting to recruit patients from Broadway Family Medicine, we encountered what I believe to be a pretty unique barrier, wherein we were told that although patients had consented to being part of research studies as patients at Broadway Family Medicine, we needed to get prior consent from these patients who had already consented, because ours was not a health-related issue, and it was not what patients would consider to be a health issue that might impact their lives when they signed that consent form. And so it was a fun time talking to the IRB about how they expected us to get consent from people who had already consented without contacting them.
I was just going to add to that. I mean, I think JMAG is actually probably downplaying the amount of back and forth we had with the Institutional Review Board on this study. And this isn't to disparage the IRB in any way, because we all know, I hope that we all know that the IRB is in existence for very real and very important reasons. I think, one of the interesting things, this was the first study that I have ever had audited by the IRB. And as I asked around to all of my colleagues, particularly those who have been doing research for quite a bit longer than I have, everyone across the board said they reported that they'd never actually had any of their studies audited by the IRB. And so, I think there was a lot of energy, and particularly JMAG's energy and time, that had to go into really, and Dr. Prasad, who I think is on the call as well, into really walking folks through why this is an important and relevant study, how we've thought about sort of all of the ways to keep people, particularly emotionally and mentally safe, throughout the process. But yeah, we keep saying we're going to write a paper on that process, and I think we still need to do that. Sorry, go ahead, JMAC.
Yeah, and so another piece of the study that came up is we were invited by someone who works with the city of Minneapolis in their youth development, youth council, to attend a meeting and kind of share our study in hopes that these folks who work with youth and youth serving organizations and parents would kind of spread the word about our study. And we had an experience that I, as a researcher, I'm sure I will remember forever. So we walked into a room that is a coalition of social service agencies and law enforcement, and received a lot of pushback, saying that in the gentlest way, from the law enforcement officers in the room, and just hearing things that were a lot of defensiveness about our study. So claims that we were kind of padding the results by the way we had asked our questions, although we're using validated survey items, things about police violence is not a real problem in the lives of Black youth. The real issue is Black on Black crime, and that's where we should be focusing our energy. Had someone pull out their phone to show me that instead of doing studies like this, the real issue is the fact that they received 5 emails last night about people being shot in North Minneapolis, and why weren't we focusing on that? So this really was an eye-opening thing for me, because it just illuminated the mental gymnastics that folks would go to not talk about police violence. We had a white female officer tell us that she worries equally about her children as a black mother would, and that there is no difference, and only to be met with her colleague who worked in a social service agency who had both white and Black children, kind of telling her, no, that's not my reality. I know that my white children can do X, Y, and Z things, whereas my Black children do not have the same luxury. So even within this agency, having 2 people who saw this issue completely differently, and kind of showing to us that what we saw as an important issue and what we had heard from community members to be an important issue, that there was still a lot of pushback institutionally about the relevance or importance of the stress and the trauma that Black parents deal with. So would love to talk more about that or any other part of this presentation. I will end by acknowledging the wonderful team of collaborators we have had throughout the very long course of this project.
I also want to just add, as far as acknowledgements go, this work was initially funded by the University of Minnesota through the Office of the Vice President for Research. It took a couple tries, and but they were the first ones to really put forth funding for us to dig into this work. And then that was followed by the Minnesota Academy of Family Physicians. And currently, the big version of this work, the R01 version of this work, has been scored favorably at NIH, and we're hopeful that we'll be able to really dig into this, to these questions in several different ways sort of across the country. And so we're excited about how that initial funding has really contributed to building up the body of work in this space. And there's a lot of questions coming in, so I'm excited to dig into those. So thank you.
I will stop sharing my screen.
Great. Yeah, we do have a lot of questions. Thank you so much for that really important work that you presented. There's a question from Prashasti Bhatnagar, and I apologize for pronunciation. Thank you so much for the work. So the question, I'm curious to learn about your thoughts on how to translate this research into solutions. and how to meaningfully address the legacies of structural racism in an upstream manner. Love your thoughts on at what point do we stop conducting research and move on to addressing the root causes.
I can start, JMAC, and then feel free to jump in. I'm going to start actually at the bottom of that question around at what point do we stop conducting research about the well-known realities of the role of structural determinants or racism? Because I think for me, that exact question is, first of all, it's at the crux of all the work I do, right? But it certainly was very apparent in this work because personally, as someone who identifies as Black, who grew up in this very community, right? I am very well aware of the lived experience of folks who live in the Twin Cities and are encountering police violence or the trauma of living in over police communities all the time. And I think we got a lot of questions about that from participants actually in our study who were like, why should I participate? Like what will change, right? And when are we going to stop sort of documenting what we know to be the lived experience? And I struggle with that because on one hand, I think that, and this speaks to the article that I mentioned early on when I kind of gave the background to this talk that JMAG and I recently published in the journal Health Services Research, where we really are asking our colleagues to think about whose evidence do we consider to be real? And the fact that the evidence of, people with the lived experience and who are closest to this pain is not typically considered to be real. And it's not real and it's not empirical evidence unless it's published in the top, sort of academic peer-reviewed journals. And so, part of it, I think, is a need for a disciplinary shift in how we consider evidence and what we consider to be real evidence. Also, I think, it's a matter of constantly sort of getting this message out there. When we started this work, as JMAG said, the time it would take to sort of convince people that police violence was a public health issue, that's usually like all we had time for. I think now, 3 years later, 4 years later, we're in a different place where I am hopeful that we'll see more sort of policy initiatives to really work on these issues.
Next question from Tricia Alexander.
Hi, first I want to say thank you both for pushing forward in this work, especially amidst waves of pushback, because this work is so paramount to, Black folks' survival. And my question is really around the portion JMAG talked about with, Black birthing folks deciding whether or not to have children based on their experience or living in a neighborhood with the experience of police violence. And I think about the history as well of forced breeding with enslaved people and wet nursing and that generational trauma that a lot of Black birthing people experience, as well as the present day traumas that they experience. And I want to know what you all think is the role and the interplay between OBGYNs, mental health services, physicians, all of these healthcare providers in really supporting those conversations in their offices. I think of my experience. I'm in my mid-20s and my OBGYN wanted to start this discussion around, whether I want to have children or not. And I felt that they were not in a place to understand those complexities. So I'm wondering what your thoughts are on how those healthcare professionals should approach these conversations with Black birthing people and what they need to do to better support them.
Yeah, thanks, Tricia. I think that's a very real question and something that we've seen in other aspects of our work, specifically our work at Roots Birth Center, but also our recent commentary in health services research, where we looked at the importance of naming racism. And I think other work that we have done in collaboration with another colleague, Dr. Brooke Cunningham, that talks about why it's important for medical professionals and for patient-facing medical professionals to understand the impact of racism, to understand the pervasiveness of it in all its many forms and how it impacts the health and well-being of Black people. Thinking specifically about Black birthing people, we know that that racial concordance and cultural concordance really matters in this work, and like how providers can do that. We see at Roots Birth Center, their staff, which tries to ensure some cultural concordance, is able to really have those delicate conversations, not only through the relationships that they build. So providers need to invest more time and really build those strong relationships, because yes, it's important to talk about racism as a structural determinant of health, but it's not something that can happen with someone the first time you meet them, right? You have to have a strong relationship and some basis of trust in order for that to happen. And I don't know if this exactly answers your question, but simply put, yes, it's something that's important that providers should think about. And for Black birthing people, it comes to a relationship-based issue, and we need providers to think about building relationships with birthing people in a way where those conversations can happen.
I would just add, speaking to the relationship piece that JMAG just mentioned, JMAG and myself and Dr. Kazimano have written a piece that is published in the journal Birth that really speaks to and breaks down sort of what relationship-centered care looks like through a critical race lens. And I think it offers some sort of insights for clinicians and providers as they, grapple with exactly the topic you just brought up, Tricia. I was also going to add that in addition to Dr. Brooke Cunningham, who's in the Department of Family Medicine and Community Health, Dr. Andrea Westby, who's also in the same department, so these are folks in our own backyard. Dr. Westby's doing a lot of work to think about how to infuse reproductive justice lens and training into family medicine. And I think the same needs to happen in OBG, for OBGYNs and all training, frankly, so part of what we know is that there is an anti-racist lens is missing from the current way that our future clinical workforce is being trained. And part of that has to include the history that you just pointed out.
Mm-hmm.
Question from Gabrielle Horsford. Wondering, did the answers change after the Floyd murder?
So that's a great question. We actually finished this work and pulled our survey out of the field and the interviews out of the field a week before George Floyd's murder, right? So what we hope to see happen with the pending funding that's under review right now is to be able to do a George Floyd sort of case study to really understand both qualitatively, but also from a sort of quantitative perspective as well, how that incredibly high profile incident and the civil unrest that followed, how it's impacted reproductive health outcomes and reproductive equity, both locally, but also across the nation, because we know that these are not, these are things that are happening perhaps here in our backyard, but are being broadcast in many ways, shapes, and forms across the nation and the world, really.
Kumi Smith would like to hear a little bit more about the challenges of recruiting participants in the North. And she was curious to hear more of what JMAG alluded to regarding positionality.
I think Rachel kind of hit on this, and the real issue, I don't think it's an issue with recruiting in North Minneapolis. I think it's an issue of trying to recruit and survey and do research on populations that have been oversampled, especially about a topic that is so sensitive and that is in need of real reform and real action and real support. And Dr. Hardeman talked about the tough conversation. I believe it was in one of our earlier interviews, we had someone who I had spoken to on the phone who was very defensive about being contacted and was like, what are you doing? Who are you people? Where are you from? Showed up to our focus group and like, really, I wouldn't say take us to task because it was done so lovingly, but asked us like, what is the result of this? I am sharing with you something that's very vulnerable. Like what will be the end product? And I think those are very real concerns. And I think I'm so fortunate for the amount of people we were able to recruit because just of this history of over researching that we see.
I would just add also, I want to give a shout out to UROC because we, about halfway through our project, we officially affiliated the work with UROC. And, I think, as we think about and grapple with sort of the history of the community and the university and what that, sort of, I mean, I'll start by saying, I know we don't have a ton of time left, but I think it's incredibly important that our students and our faculty understand sort of the history that's there and the struggles that the North Side community in particular have faced in sort of interacting with academics and how research has been done in the past in those communities, because that has to be sort of at the forefront of how this work is approached. And, I think JMAG and I went in very, very much aware and well-versed in that. And, being affiliated with UROC along the way too certainly helped with that, but it doesn't erase that pain and it doesn't erase that reality and that lived experience in any way. And so I think we have a lot of work to do sort of broadly and how we continue to repair those relationships. Because even if it's not explicitly part of why someone may have like turned us down for recruitment or showed up defensive, it's there, right? It's always sort of underneath the surface.
Question from Dominique Erland. You spoke about some of the ways Black mothers compensate, cope with the reality of police brutality, such as overprotecting their children. Can you talk a little more about that, as well as your own personal challenges or joy of working on a study that aligns with your identity as Black women?
Yeah, I will hop in there. I think folks talked about a lot of things about this idea that I will just teach my kids the best I can so that they don't have to ever interact with the police, or I will just watch my kids when they play to make sure that they aren't doing that, they somehow don't interact with the police, or I shield my kids from the police in the community, things like that. But I think a huge takeaway from this work is that there's just so much love there, and this is something I want to get out there, that folks do talk about being afraid and the relevance of this in their life, but what we hear most is that these are parents who are going to parent and love their kids and raise happy and healthy kids to the best of their ability. Yes, policing is in their life, but they, time and time again, we heard, I'm just going to do what's best for my kids. I'm going to do the best for my children. And so kind of to Trisha's point a little bit, this idea of there is resilience and there is strength that supersedes any threat that is posed by policing, and that folks are really committed to loving and parenting despite this obstacle.
Yeah, I would just add to that, exactly what JMAG just said. And it almost feels like, so parenting despite this pain and despite this reality it's a form of resistance in and of itself. For me personally, to answer the second part of your question, Dominique, is, the challenges are certainly there and they're always going to be there. But the joy for me is that I'm a mom, right? I'm a mom of a 7-year-old daughter who I want, just like JMAG described in our study participants, I want the best for her. And, my work and what I've committed to do is to really ensure that I can build the empirical evidence that will offer change that allows Black people, Black women, Black girls, Black babies to live their full greatness and their full glory. And so that for me is what sort of drives the day to day, even when it's hard, and even when, and we had a lot of folks push back, and we had a lot of people say, I'm not talking to you, I'm not going to do this. Even despite, JMAG has done I'm incredibly grateful for her leadership in this space and continue allowing this to continue and move forward. I think it's keeping an eye sort of on that end goal and on the end game.
I think this question from the East Coast. Looks like somebody who might know JMAG, Warren Lowell. This just wondering, maybe this is a question for future like research steps. If you've considered stratifying your sample by race or ethnicity to highlight differences in the extent to which police brutality impacts birthing folks' decisions and feelings about their birthing decisions and their children's safety.
Yeah, thanks for that, Warren. And this is a conversation I remember us having in like 2017 or 2018, Rachel, as we think about research. And I think we were talking with a potential partner. Of course, we offered, thinking about rolling out the study, we were asked by a potential partner to administer the survey to all people and recruit white identified people into the survey. I had completely like blocked this out because
Yeah,
it
I did too.
so interesting, because they as a clinic did not discriminate against patients, and by only recruiting Black patients, we were somehow discriminating. But the truth is we don't need a study that has an equal number of white people to know that white people do not face the same threat of police violence. There are existing studies. We just know that's not the case. And so we think it is scientifically valid for us to have a study that only looks at the experiences of Black women and does not have a white reference group. Rachel, I don't know if you want to speak to that a little bit more.
I mean, I think you said it perfectly. And, you know, for those who are questioning that or want to understand more of that, I point you towards Dr. Chandra Ford's work in public health critical race praxis, which is another incredibly important framework that certainly intersects with the reproductive justice framework that really lays out beautifully sort of why that frame of reference is not necessary. And it's really about you know, sort of questioning and dismantling sort of the norms and research around sort of what a comparison group and what the standard is, right? So we are so quick to assume that the standard in which we want to compare our populations and groups, particularly in racial, when we're doing racial disparities work, is white folks. And to JMAG's point, I mean, we know that that's not an appropriate comparison group in this case.
Well, we are actually 2 minutes over, so I just really wanted to thank you both for joining us today. I know how incredibly busy you are. Rachel, I think you said that this was your sixth talk of the week and you have one more to go. So really appreciate it. Thank you so much for joining us. This was really, really important and helpful.
Thanks for having us.
Have a good weekend.